Hello, my name is Kathleen Marivilas. Today I'm going to do a remediation for my previous central line dressing that I have missed. So first, I already prepared my materials to use for the dressing, and then we're gonna perform hand hygiene. Oh, before anything else, so I have my mannequin, the dressing on the catheter, a central line dressing kit, 2 masks, clean gloves, and a waste bag, and hand sanitizer. So first we're going to go to the patient's room, and then you're going to perform hand hygiene, and then we're going to introduce, provide privacy to the patient, and then you're going to introduce yourself to the patient. Hello, my name is Kay. I'm here to change your central line dressing. So, and then you're going to verify the patient's name and date of birth, patient verified. So now we're going to perform hand hygiene again. Of course, you're going to explain to the patient what you're going to be doing to the patient. So first we're going to apply our mask. And then you're going to instruct the patient to turn their head away from the site during the dressing change, or you can provide mask to the patient, which I am going to provide the mask. There you go. And then we're going to apply our clean gloves. So now we have applied our clean gloves. We have to remove our dressing by stabilizing the catheter with your non-dominant hand, and then remove the dressing by pulling up on one corner on each side and gently pulling straight out and parallel to the skin. And you want to do it in all corners. So we're going to do that, and then we're going to toss our dressing out. And then we want to make sure that we inspect the catheter, and then we want to make sure that we inspect the catheter, the insertion site, and the surrounding of the skin, which there's no redness, no swelling, and then you ask the patient if there's any pain. Patient verified that he has no pain, so we're going to remove our gloves and then perform hand hygiene again. So then now we're ready to open up our central line dressing kit. So opening the central line dressing kit, you open it up away from you. And then you want to pinch both sides to make sure that it's not gonna close when you are doing your central line dressing. And then we're gonna pick up our sterile gloves. And then you want to make sure that you're not touching the kit. So then you're going to don your gloves. Which this gloves is stuck. Okay, and then you're gonna scoop the other side. Okay, So now that we have our sterile gloves, you want to pick up the chlorhexidine to use for to clean the area. So now we're gonna pinch the side to let the solution out, and then we're gonna clean the surrounding side back and forth for 30 seconds. So we want to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Oh, and also you want to hold the the tubing while you're cleaning. So 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then once you're done cleaning with the skin area and the insertion area, you wanted to clean the tubing as well. But we're gonna start with the bottom part, from down to up, and then doing the same thing on the other side, down and up. And then you can put this aside and put it down because it's already, the area is already clean. So we're going to toss this out, and then we're gonna let it dry. We're gonna let the skin dry before we can even apply our sterile dressing to the skin. So that's where it stops on my remediation. Thank you so much.